with both Ericsson and Blue Cross Shield. And we had a lot of questions that came in beforehand. I think there were two questions maybe that we wanted to maybe kick off the session first with. The first question was about more from a global perspective. So I think in the video that you watched, you saw, Ericsson, we're in about 180 countries. And there's a lot of questions coming in around, how do we look at maybe, again, broadening this to other parts of the globe, whether it's Europe, maybe different parts of the world where it can be very, very difficult. And I have to tell you, this for us has been a journey, and the journey never ends. It's still continuing. We, as I mentioned earlier, we started this journey specifically for our transgender community back in, probably the start of 2018. We've come such a long way in the last 2 years. We've seen a huge culture movement, I think, in Ericsson in North America, and it's definitely starting to have a ripple effect across other parts of the globe, and also with our headquarters in Sweden. So we are having a lot of conversations, how we're connecting what we're doing here in North America with our headquarters, and we're also actually connecting with other regions that are struggling, specifically, supporting the transgender community. So I'm not saying we're perfect. It's definitely a journey that we're going on. And again, hopefully next year we can come back and showcase more that we're doing from a global perspective. I think the second question that I wanted to bring up that was brought to our attention was around, I think specifically around the facial feminization. And I think either Shadoa, Liam, or I think Shadoa, I think you wanted to talk maybe about that also.
Yes, that's correct. Within our medical policy, and more specifically Ericsson's benefits, facial feminization procedures are covered. That can be anywhere from a brow lift, a rhinoplasty, different things like that. So yes, they are covered secondary to, a top or bottom surgery.
Jess, did you want to add anything to that?
I'm sorry. Did I want to add to that?
Yeah. I
was distracted. Internationally, I don't know that I have a lot to say, but I do know that, Shada and I have been in conversation about voice feminization surgery, which I'm now pursuing for obvious reasons. It is indeed covered. We're kind of in the same place we were with the bottom surgery, which is finding an adequate surgeon and one that we can get pulled into network, which is, I think, our work for this next year.
Very good.
Gary, this is Aldi Duffield at Apple, and I know I've asked this question a couple of times, but I do want to suggest that we understand better providers that are recommending services, that they're really fairly assessing the needs. And I think as employers, we want to ensure that we're providing all WPATH compliant coverages, which at Apple we do. I think I struggle a little bit about the surgeons themselves. And the ability to service the right level of care for our community and not overdo it or underdo it, or really just meeting where each of our members individually need to go. And we get caught up a little bit in the ability to get access to the right level of providers and providing the level of coverage that's needed. As the chats were implying, some of this is not cheap. And so as an employer, we all have to face that responsibility of being equitable where we know it's appropriate. But I advocate for the right level of care and the need to meet our communities where they are. But I was curious if Ericsson has had any more experiences on how to get to that right balance in light of the needs of our community.
So, yeah, so I think that there's, Jess, do you have something specific you wanted to talk about? Because I think you might have a little bit more. Okay. So Aldi, I think that, there are, Jess and Shada work together very closely, right, to find the specific surgeon that Jess used. Right. I was able to find a surgeon through networking through other transgender men. Right. And that he was already in network with Blue Cross Blue Shield. And so, but in my previous company, my surgeon the actual surgery was covered, but the surgery location, the office where he did the surgery, was not covered. So for my previous work, so I mentioned spending $10,000 of my own money on the video, and that's where I ended up having to spend a significant chunk of my own money in order to be able to have surgery, because the surgery was covered, but the location was not. So I think, that it is still a very much a opportunity around transgender benefits, being able to find the right surgeon who will work with your insurance company to do that. I know that the surgeon that Jess used, there was a lot of negotiation. Shada, maybe you can talk about that. There's a lot of negotiation with the actual surgeon's office to specifically negotiate down to which code was actually being put in order for it to be approved through the insurance company. So sometimes it gets down to that level, and it does need to be driven both from the employee and from the company itself, but also from the insurance company. So we are super lucky to have Shada, who is able to drive that conversation. And I highly recommend that every company has a transgender liaison with their insurance company, because these are very specific issues. These are issues that most people are not well educated around. And so if somebody is not trained, you just call them up on the phone, call your insurance company. They may tell you you don't have the benefits. They may tell you that it won't be covered. They just don't know that it's covered, right? And so a lot of people are turned off by that. But Shada, did you have something you wanted to say about the negotiation that you went through?
I did. And we actually had that situation with Jess. We found a provider that was a little bit closer, but that provider was affiliated with a religious facility, and they would not allow the procedure to be done there. So we kind of had to go back to the drawing board about that. But once we found that particular doctor, I re-engaged with our negotiators, with our network department, and we had another meeting and said, this is what we want to do. And we had already had some prior discussions surrounding specifically the state of Texas. When we went to go find surgeons that were appropriately skilled, we just, could not find anybody except for this one. That had some really great reviews. And actually, when we discussed this provider internally, our doctors were already aware of this doctor as well. So we had to take that, it took about 2 or 3 months, but we had to take it back code by code that they planned on billing after Jess had went to her consultation. And we went back and forth. We'll offer you this amount, but we kind of went outside of the standard in-network, out-of-network process. And the reason for that was because if we only left Jess with saying, hey, you can apply for what's called a PPO waiver just to make this doctor in network, they could have billed $100,000, and we could say, well, we're only going to cover 500 of that. So we said, no, we're not even going to walk you into that situation. What we want to do is make sure you're covered from the beginning. And then that's how we approach that provider, saying, here's our situation, here's where we're at within the state of Texas, and we want to talk to you. Will you accept this X amount of money per code? And they did. They agreed to it. So we could tell Jess, you don't have, this is what you're expected to pay.
Yeah.
And nothing else. No surprises.
That's awesome. And it's so great to find one in Texas. I live in Austin, so I appreciate that. But at Apple, you can imagine we use a lot of California surgeons. And I would just say to anyone, don't always assume it's just in your locale. You may need to figure out a way to get access outside of your local. Do your best you can, but it's not always that case. And we're struggling with some surgeons to this day still will not play with the insurance. And so we find our members needing to use that surgeon, which may be the right for them, but they will not play the insurance. They say, give me the deposit and then we'll talk. So I'm struggling, and I just want to advocate for everybody that please advocate back to your surgeons that this is something we need to really get ahead of. And and we have the same sort of, we have dedicated advocates for our trans community through our providers. So it's great that you have that level of advocacy because you need it, no doubt. So I won't preach to the choir here, but I'm so glad that we're having this level of dialogue, because that's where we're at. It's not, again, it's about how we as an employer can be much, much more ahead of it. So our members are not out of pocket, and that they are going to work with us and they will be willing to do what is best for that individual's journey, not because of what the doctor perceives to think is the right thing, because sometimes there's a balance to that. So thank you. Appreciate that.
Just so you know, when it was all said and done, my total cost for surgery was simply my deductible, but actually what was left on my deductible. And that was, going into that with, here, take that. And I knew I didn't have to worry about anything. I knew I didn't have to worry about getting, the surprise bills, which, you still, even though everything's right, you're still waiting. And now it's been getting close to a year and no surprise bills. So I'm very grateful for the work that STADA and Blue Cross Blue Shield did, and thankful for Ericsson for providing this.
One of the things that I'd like to talk a little bit about, change the subject, but it's related, which has to do with, the company I work for, Lockheed Martin. We've had the basic surgeries in different insurance companies, and we've cycled through Aetna, Cigna, Blue Cross, Blue Shield at times, a variety. And some of the issues that we've had to face that I'm struggling with how to tackle is that the company does not want to get involved with the insurance directly, and they hire another group. But one of the things that really I fight with is that what insurance companies deal with, the clinical bulletins that are outdated and not in line with WPATH. Getting in surgeons and professionals all across the board, from therapists to electrolysis to facial feminization to the procedures that trans men need, it'll take time to get those individuals trained and in process. And we've been so starved for service for so long, but trying to get that to happen, one of the big things we need to do is tackle it from an industry standpoint, which is how do we deal with clinical bulletins that are preventative of getting proper coverage, like a facial feminization or hair removal for trans women. So, and that's one of the things I'm really need to get a whole handle on quickly, because this week I'm going before the some of our benefits committee, and I'm going to be pushing on these issues. Any comments?
Can I just from my perspective, and I have to admit, this is such a new area for me. I think where I came from this specifically and I had mentioned it earlier about, the employee engagement, the link to customer experience, like in terms of the talent that we're trying to attract. I'm always talking to leaders about us, Ericsson, being a leading edge technology company. We're leading when it comes to 5G, in IoT. I'm a real tech head, so it's all about the technology and the business, but I'm also very passionate about what we're doing from a people perspective. And if we're trying to compete with the likes of the Apples and the Facebooks, and so when it comes to the war for talent, we need to make sure we are offering best in class benefits. So that's normally where I have my conversations starting point for any presentation, whether it's to do with D&I, what we're doing for benefits, and how we're showing up in this space, and how we're competing when it comes to the war for talent. I would then maybe hand it over to either Shadoa, Jess, or Liam to discuss maybe more on the details about what is the latest when it comes to the clinical releases.
So my question is, these clinical briefs, who are they coming down from? I mean, typically what we go by is WPATH as kind of our chief guideline. And you're saying that you're having to face clinical notices that are coming down that are contrary to WPATH?
That the insurance companies have had on their books for years and years and years. And if you go to most insurance companies and Google them, you'll see what they are. And some of them are 20 years, 30 years old. And a lot of it depends on the policies that the individual companies grapple with or apply for or put on contract. But the key point here is that they use the clinical bulletins as their primary guide for transgender care. And until HRC came out and pushed the issue back in the day, very few companies had covered transgender health at all. And it was lucky that you didn't get turned away for blood transfusions because you happen to be trans. So, we owe a lot to HRC. That being said, there are a lot of companies and insurance companies that are still clinging to the old clinical bulletins that listed this as, experimental surgeries and this is, these are, now I'm brain dead. It's been a long week. Go figure. The cosmetic procedures that are not medically necessary, and trying to come up with some good arguments or good basis for how the industry is changing and moving toward the correct WPATH.
Hey, Christine, Gary, it's Scott Mielis. How are you from Bank of America?
Hey, how you doing?
Don't get me, I'm going to get emotional here. Hi, Sam. Hi, Aldi. I see all of you there. It's always good to ask your company. It sounds like you're probably fully insured, where Bank of America is self-insured.
Well, we're self-insured, but we have, other companies actually administer the insurance claims and processes, because Lockheed Martin is not qualified to deal with HEPA and all of that stuff.
Yeah, I mean, that's the same for us. We do not actually, we don't do our own. We have a third-party administrator, but we coordinated, it's pennies on the dollar. People are looking at this like, oh my gosh, this is going to cost, and why should we do it? Well, because it is a small population, it costs us maybe 2 cents raise in our premiums. So that's not even an argument. Right. All companies are moving to this phase. And really what we did is we negotiated with our insurance companies, really because we are such a large vendor, part of their business, a client, you are as well, that we wanted someone that we have a dedicated group. So we don't want our transgender employees calling a 1-800 number and getting a random person to try to figure out what they're doing. And our different vendors are Aetna, Blue Cross Blue Shield, and United Healthcare. All of those three have aligned, like United Healthcare calls it a transgender buddy program. Each one has like a transgender health concierge service. So we just say, hey, do you mind if we give this your name and your phone number and at least an identifying information so they have your account? Instead of you calling, we're going to have somebody call you. And then they have this concierge service that reaches out, helps you navigate your specialist or your surgeon. They look at different ratings and talk you through those pieces. And then they manage the claims process. Because what we got a lot is people struggling because of maybe a gender marker, and then you're having something that's not generally covered. You would be denied, they would battle it. You're 6 months spending all of your time, your energy. And we've had people come to us and they say, I've been dealing with this 6 months. We get the concierge service and they take care of it the next day. So it's really worth having your service delivery teams or whomever's managing that benefit to negotiate that with the insurance companies. And most of them offer it for free.
And Christine, this is Aldi at Apple, if you need another alternative for getting clinical evidence, we've kind of used our second opinion service, which is advanced medical for us, our expert opinion, to be an additional layer of guidance. So it's an objective party, it's outside of the insurance, and it allows us to have another guided clinical view because, and again, this is an answer back to the countries that for others outside of the US where we need that level of expertise because they know what's available, what HRT drugs are in that country, how do we actually get access to services, what kind of services are clinically proven. So we've relied a lot on our expert opinions to kind of be a complement to the carriers if needed, or just to help us make a decision. And we are self-insured outside of the US as well. Yeah. So it gives us a lot more flexibility.
Yeah, in that regard, you're much like we are as far as global, we've got folks all across the world that, we're trying to make sure we have consistent coverage and benefits. And I think I actually met you last year. It's amazing how many people I recognize on this, virtual world. Oh, I miss being there in person. But, I actually have a couple of our other Lockheed Martin folks on this line that's, here as well. And I'm glad this conversation is being held.
We need to elevate WPATH higher. WPATH has got to move. We're on 7.0 for too long. I've talked to Dr. Green about this. We have got to move 7.0 to 13.0 and let's move on with it, but we're not there yet. So that's part of our struggle is WPATH is still, to me, not proactive and forward enough. We need to get it further ahead.
Absolutely. So yeah, I'll take a note and I'll make sure that our folks talk to you, Andy. And was that Scott talking from Bank of America?
It was.
Long time no see, Scott.
Yep. Good to see you. Good to see you, Sam.
Hi, Scott.
We'll call you out anyway.
Hi, everybody.
Thank you, Dr. Green, for saying 8's going to be out. I've told Jameson, you know, he's on the clock. Or Jameson, you've got to get us there. We've got to get there. So thank you for letting us know. It's coming.
Believe me, I'm working on it.
To both.
Hey, Jameson! Go, Jameson!
I am definitely working on it. And trying to get more surgeons to take insurance too. It's really, it's a big push from many different directions on many different fronts, including in Europe, where coverage is actually part of national plans. I mean, Gary, you were talking about providing your benefits globally, Aldi, you as well. It's covered on national plans, but they also have too little in terms of adequacy of network. They have so little available providers, and it's a lot of it's because of so much just general apathy toward who trans people are, and disapproval, basically, frankly, of trans people in the world. And so it's a hard slog.
It is.
I think one thing to add as well, I think, you know, I'm a big believer in change and how we bring people on this journey, and you know, and how we change people's minds, their hearts. You know, I can tell you, I mean, 2.5, 3 years ago, if you would never have heard the word transgender in the organization. It just wasn't ever spoken about. It was just never, you know, so I just think, you know, the visibility, the awareness, we followed a whole change management process, ADCAR, maybe some of you are aware of it, but we had a very dedicated, you know, team making sure that we were being very intentional towards the transgender community and making it safe within Ericsson for that whole transition to happen. So I totally agree with you, Jameson, in terms of, you know, it is a slog, but I think there is definitely intentional steps that you can take just to open up the company and just to make the conversations happening, to start happening specifically around the topic. But it is a journey, and we still have so much more work to do.
Yeah. And just to let you know, I was the one who drove the HRC Corporate Equality Index, all of their materials about how to move insurance and in corporate benefits forward through the CEI, all came from me and my colleague, Andre Wilson, back in the day.
Very good. Very good.
Jameson, hi. Emma Smith from Air Products in Pennsylvania. We met last year. Hi, Scott. We met last year. Hi, Sam. Met you not too long ago. Happy Summit, everybody. I wanted to ask, because last year you mentioned, Jameson, that they were pushing for an update to the standards of care.
Yep.
Do you know where if there's an update on that, like progress?
It will be coming out next year.
Next year.
It will be coming out next year. They were hoping to get it out this year. It's not ready yet. Then they were looking at mid 2021. Now it's possibly slipping into the fall, but it's really shaping up nicely. And we have over 120 contributors to the standard. We have a very, very academic process coordinated by Johns Hopkins University to make sure that this is a consensus-driven process and that it's validated by evidence. So that's where we're going, and that's why we want it to be very, very solid.
Excellent. I appreciate it. Thank you.
You bet. Thank you.
So
I'll get out of your way now.
Oh, no, you're good. Thank you, Thank you, Jameson, for everything that you do and for all that you have done. I do see a question in here, or it's more of a statement really, but it's something I do want to address, which is that too often healthcare professionals are telling us that their training on the full spectrum of LGBTQ is about a 2-hour training total. It's not helpful, and it leaves many holes in their understanding. And I just wanted to affirm the fact, yes, that is true. One thing you can do, I'm not necessarily asking all trans people to do this, but if you have the time and are willing to put in the time and effort, you can volunteer to help train. If you're near a medical school, you can help train future doctors how to treat transgender patients. I know locally here in Dallas, there's UT Southwestern, which is one of the top medical schools, and they a couple times a year, they have trans individuals and LGBTQ individuals come in and do patient care, actual interactions between us and the future doctors to help them understand what they may experience as they get into their own practice and are treating us day to day. So that's just a really good idea if you're willing to do it. I'm not saying you have to do it. I'm saying if you're willing to do it, that's a really great idea to future proof our medical care, right?
Liam, can I jump in on that a little bit?
Yes, please.
It's true that they're starting to offer elective courses in medical schools. Most of those are generated, or the interest and the actual establishment of the course as an elective course is done by students. Many of them are LGBT students themselves who put these courses together and get them to happen. They're not required courses. So getting this material into the required curriculum of medical schools is still a ways away. And part of the problem has been that insurance has not covered the care. And because I had a medical school dean tell me once many years ago, there is not a chance that we will spend 1 second of time training our people on anything that isn't going to be reimbursed. So it's a very mixed up web of complicated systems that we are struggling against. And, thankfully we've got LGBT med students now and ally med students who are advocating for training on LGBT issues. So it's slow, but every little bit can help.
Work in progress. I think there was a question I saw in the chat from Jessica Drake. Shadoa, did you want to take that one?
Yes, I do. The question was, do we have recommendations on how to ensure that training and communications are handed down to all phone reps? And that's something that we did discuss, and that's one of my 2021 goals, but specifically with Ericsson, we want all of that to go through only me directly. And there's many reasons for that, but I saw in the chat too that with other insurance companies, it kind of ends up as a train wreck when you have multiple people that, you have to call in. You may or may not get the same person. They don't know your story. They don't know anything that has happened to that point. So that's why I decided to jump in and experience this with Jess, with the intention that build it and they will come. So this is eventually going to get more than I can handle as just one single person. And then I will hand it off, but definitely not at this point, something for 2021. But through these experiences with the different surgeries and, every case is so different and so unique that we want it to be very controlled, and we want to make sure that all of the training that is rolled out, how do I say this, to where it helps everyone to be more comfortable. Because we pulled reporting when we were preparing for this summit. We pulled reporting, and in almost a 2-year time span, we had 5 phone calls, just 5, to talk about transgender benefits, which was very shocking. That tells me that people are not comfortable calling in. They're not comfortable just talking to anyone about these super sensitive and super personal procedures. So, we're all learning. We are all learning. And I can tell you that all of the ears are open at Blue, because we want to know what is everyone experiencing on a personal level. I don't know that there's ever been anyone else that jumped in consistently, so I can speak to many different experiences for our trans community. So I say it's a work in progress, and we are all learning get better, but that's something that I do want to create. We're just not quite there at that point yet.
Maybe to add as well, just one last point on that was that even when, you know, this whole session was build it and they will come. So as I mentioned, I think at the start of this video, and again, my ignorance, I was unaware of anyone trans in the organization, but I knew it was the right thing to do from an LGBTQ perspective. I can tell you those that did reach out, the highest percentage of those were from our field services. They were tower climbers, they were, you know, technicians, and it was great to see that. And we do definitely have a lot more work to do in terms of maybe the communication and how we handle that kind of client relationship. So just wanted to make that point.
Yes, yes. And a few of the referrals have come directly from Ericsson, but what we're finding is it's people talking to each other. Hey, Shadow, help me out. So here you go. And we've made that clear that that's okay. You know, if Liam has someone that reaches out to him, give him my email and my telephone number. I'm here to work this out. You know, we're fully committed to Ericsson and making sure that if anybody runs into a problem, we'll be there to correct it immediately. It's just we're handling it a little bit differently than most insurance carriers. One thing as well, Shadow, maybe just one last point from my side on this is that I think where we have really struggled is the fact that we're business to business. So we look at the likes of the Bank of Americas and the AT&Ts where they have to be seen to be kind of replicating and doing the best for this has been a real struggle for us within business to business, because I think we struggle in terms of who's best in class when we look at the competition. So again, I think it's work in progress. Thanks, Shadoa.
And I did want to ask, Shada, I think that you had mentioned that you mentioned that there were 5 that had called in, right? But that I believe you said you're working with over 30 people, right?
That's correct. So, it's about 25.
Yeah. So that's so that's just a real quick example of the number of people who will call in wanting these transgender benefits versus the number of people who will finding out just through the network, just through me reaching out, somebody reaching out to me and saying, you know, I have a son who's trans, and me being like, here you go, here's Shada's information. You can, you know, top surgery's covered, bottom surgery's covered, testosterone's covered, hormone therapy's covered, right? And so many people just don't know that and are so worried and so scared. And I'm seeing that in the chat that everybody, you know, it's fear, right? There's still a significant amount of fear about coming out in the office or coming out even to your insurance carrier. So anything your team can do to help decrease the amount of fear and increase the amount of education that they have around transgender benefits and around transgender people in general is going to really help not only getting the individual to be able to use their benefits that we've offered, but also make it so that the individual feels safe to do so while they're at work.
And this is Aldi again at Apple. I'll say I just applaud Ericsson's intent of really, especially being in Texas, it's such a different, sometimes dynamic. We have dedicated individuals like Shadow in-house at Apple, and we have dedicated trans advocates in the carriers. Our volume is, as you can imagine, a lot higher. But we've also now are putting on annual town halls for the upcoming, this is our busy season, right? Open enrollment. And so we will be advocating to have our community have questions about open enrollment, speak specifically about coverages, because we do have different carriers that you can choose from. The designs are the same, it's just different administrators for network reasons. But I do think it's great to have that also as a way to help advocate for the support, because sometimes people, in light of open enrollment, we can talk about the shadows. Sorry, we don't want to overwhelm you, but we do use them and we advocate them, and we get a lot of good testimonials from our community about using individuals like Shadow to help. So we've seen a lot of positive reception once our community is aware and that they are there dedicated, and you don't have to repeat your story. You get the same advocate every time. So I think that's made a difference in that trust and ability to feel like the insurance company is actually supporting me, and that says a lot for our company too. So it's a partnership for sure.
Definitely. I think one of the things that, you know, as I joined the company just a year ago, I originally wasn't going to be out. That lasted approximately 2 months because I am way too proud of being trans. And so I came out anyways, because I'm proud and I don't really care who knows. And I think that it's an amazing thing. And I want people to see that there are trans people everywhere, that we're not just, we're not just in the movies, right? We're literally working next to you every day. And so, you know, one of my roles as I came on to the core leadership team for our LGBTQ ERG at Ericsson was to really work with Jess and her wife, Debbie, right, to be the transgender representatives, and to be able to have somebody to reach out to and have a conversation with if you are transgender and want to come out at Ericsson, or if you are transgender or you have a child who's transgender or a nephew or a niece, right, a sibling. So I think that is sometimes just as important as having the benefits, right, is having the people there to be able to point you to the benefits and have the discussion with you that it's going to be okay, both if you're trans or if you have a loved one who's trans, right, it's going to be okay. And I think that is just as important as the medical benefits.
All goes hand in hand.
Yep.
It certainly is important. This is Tamara talking, and that is very important because, as Christine mentioned, there are many individuals who are considering transitioning who have not done it yet. And to have one single point of contact in the insurance company would be a huge help for those individuals so that they don't have to essentially disclose themselves every time they talk to a new individual. It's much better if you have one person, you talk with them, you establish a relationship, and you trust each other, and that they know that that's confidential. I mean, it's just between them and that person. The company is not going to find out that they talked to this person, but they will get the information that they need, and that's critical.
Very much so. I agree with you, Tamara. It's very much so because so at my previous company, the company I was with before this, we did not have a transgender liaison. I was also the only out transgender person in the company at the time. So I was blazing my own path. And I did see in the questions earlier, or in the chat earlier, about not making it on the transgender person to find the doctor and to find the services and to make everything okay for the company or for the insurance company, right? It is critically important. I've done that work. I've done it for myself and I've done it for other people. But if I could go back again and I had someone to contact who would walk me through the whole situation, I probably wouldn't be out $10,000 is step one, right? And also it would have been much less stressful because also remember that this is added minority stress that you're adding on top of somebody who is already experiencing minority stress. They are now having to possibly make phone calls to providers that they do not know, and they do not know how that provider is going to react to them on the phone. They may get laughed off the phone, right? They may go into the provider's office and they may get laughed at to their face. So it is critically important that we not only take the onus off the individual to do that work, that we provide that work there for them, but also allowing the individual to have some level of ownership in their care, right? It can't be that, well, we only use this one surgeon, we don't use any other surgeon. If that surgeon doesn't do the surgery the way you would like it to be done, then it's not right for your body. So, and there are so many different, especially and I know there are for trans women, but for trans men, there's 1,000 different ways you can do bottom surgery. right? And it is, you know, and each one of those is very individual to the person. And it's important that that person is able to get the body the way that they need it to be. So just another couple of things to remind yourself as you are exploring the need for benefits and exploring the need for having a SHADA. And I hope that everybody starts calling that's their nickname for all of their transgender benefit coordinators, is that it's going to be, you know, the SHADA role. It's, you know, so you're going to be famous after this. That's the goal. But that's just another critically important point. So do we have anybody else? I mean, we've got like 80 people on the thing. We've only had a couple people ask questions. Does anybody else want to raise a hand and ask their question? We'll highlight you.
Liam, I wanted to take one statement from Laura, and she's talking about knowing whether your insurance company is LGBTQ friendly, transition or not, is very important. And I'm going to tie this back into actually what Christina said originally, which was she was talking about some of the companies she's dealt with are dealing with old information. There's one other factor that Shada and I did not discuss, but I'm going to bring it up, and that is some of the surgeons that we did find who were not in Texas, or some of the surgeons we found in Texas, we're dealing with 2 and 3 year wait lists. So I'm looking at this from a perspective of you're really looking at market competition. When you're looking at an insurance company, if they're not LGBTQ friendly, if they're not going to offer the benefits, then that is a marketing decision for them that's going to work against them. Ericsson looked specifically for a company that was, and I think all of your companies should question your insurance company to see what they provide. Because there's such a waiting list, there's growing demand in the United States for more surgeons who can do this, and you're going to see it become more and more not only acceptable, which it has become much more acceptable in the last few years, but you're going to see it become more common for these things to be out there. You're going to see more surgeons wanting to fill this need. The need is overwhelming in the United States right now. I was very lucky to find somebody who could get me in within 6 months. So that tells you there's a market force driving these transitional surgeries that is going to help out a lot. And the insurance companies are going to have to vie for your attention in the future to get your business. And I think that's something that if you're in that position in the company where you're looking at your insurance, you need to know that, you know, this is a marketing thing. You need to ask them, and they need to have an appropriate answer. If they don't, keep looking, because they're out there. There are, you know, Blue Cross Blue Shield is not the only people. They're the best shot, but they're not the only people out there doing this. And I think it's going to be a matter of the marketplace is going to just drive it.
Thank you, Jess. So there has been a very popular question in the chat that is, what can we do as allies and ERG leaders to advance transgender benefits? And Gary, I'm gonna call on you for this one as our transgender ally and resident ERG leader, the starter of our ERG at Ericsson. How can we do that?
So I think there are so many things you can do. I think maybe I'm not too sure where exactly you are in your transgender, let's say, benefits journey, but I think the first thing to realize is that you're not going to bring everyone on this journey at the same pace. And I think, as I said earlier, you know, even the term transgender, I mean, in my head, I mean, I've been out for 20 odd years, but you know, I was very conscious about how this was going to land in our organization, and I did not want to alienate people or not bring people on a journey and educate them as to, you know, where we were going in this journey. I think you need to bring people, before you maybe even start talking about transgender benefits, you need to see where they are in terms of their head around diversity and inclusion. We've been very fortunate that we've really advocated with our senior leaders and CEO of North America on the importance of D&I for our business. And we're now seeing it's mentioned in everything. I mean, having a diverse team, that's where the conversation starts. And even, I can tell you, when the first person that wanted to transition in the organization, and we kind of wanted to talk through what that looked like and talk with the manager and the team, the number one topic for me was diversity and inclusion. So before we even get to transgender, let's talk about diversity and inclusion and what that means for us within Ericsson, our business, our strategy, where we need to be playing, where we're getting the best talent, and let that all sink in. We can then move from D&I to LGBTQ. And yes, they know that I'm gay, I'm openly gay in the organization, and I have no problem in being that face. What I have learned though myself is, I used to always call myself a gay man, a cisgender gay man. Now I see myself as, cisgender gay man, transgender ally. And I want to be an ally for the transgender community at Ericsson. And this is where you need to start you need to be at the table, maybe in certain, maybe senior leadership discussions, talking about transgender medical benefits. And depending where you are, I mean, if you're not offering transgender medical benefits at the moment, maybe you need to start asking hard questions why that isn't happening. Maybe get allies. I mean, it's so funny when I started on this journey, even though now I'm in HR, I was not in HR at the time, but I was working with somebody else in HR. He was a straight cisgender male. And in the back of my head, I was thinking, okay, I'm now going to have to manage maybe someone transitioning in the organization. And I'm also going to have to manage this person in HR who probably, this term transgender is very, very new and is possibly alien as a topic. And I was really shocked at how a lot of, how many allies we actually have in the organization. But you need to start having the conversation and start talking about, what it means to be transgender, what that looks like, what the face of transgender looks like. We were so proud to bring Jess on site. She came to our first Pride event, which was in 2017. We had a movie night. And again, I was so proud to be bringing, a transgender female onto the Ericsson plant, and for people to engage with Jess and to start. Some people had never even spoken to someone that had transitioned or was transgender. So, but you need to get that visibility. I can tell you we've come a long way, I think, in the last 2.5 years, but I think visibility is key when it comes to that. And I think one last thing I would mention is that there are many of us that have privilege. I am extremely privileged. As a white cisgender male, I'm extremely privileged. And I think those of us that have the privilege, we need to make sure we're challenging, we're kind of bringing the topic to the forefront, and we're asking questions and we're challenging. So I hope that helps to answer some of the questions.
Yeah, Gary, I think that was great. I would love to jump on as well with your privilege comment. It is critically important, especially as allies of an incredibly marginalized community like the transgender community, that you step up and step into this space and make things happen for the community as an ally. So here's what happens, right? If I go and ask senior leadership for transgender benefits, it's seen as I'm asking for myself, right? But if Gary goes and asks for transgender benefits, he is seen as asking for the LGBTQ community, right? It's not a direct ask for him, so it doesn't get perceived that way by senior leadership. So it's important to have the face of the people who are transgender. Don't out people, please do not out people, right? Don't even out them to senior leadership. Ask them first if you are going to use their name and likeness. But have the face of the transgender person, have the story of the transgender person in mind, but utilize your privilege as somebody who's not transgender to make that ask and to make senior leadership realize and HR realize that this is something that is important. And it's not just because there's a transgender person who wants to transition, but this is something we should be offering for all of our employees, because we have employees who have children who are transgender, our sisters who are transgender, wives or husbands who are transgender, right? So it's not just our direct employees who are impacted by these benefits. So let's see. So there's a question, Shada, that might be for you. And I'm not sure if you'll be able to answer this, but do you know what Blue Cross Blue Shield's next 3 priorities are to improve transgender healthcare? Is that a conversation you have had?
No, I couldn't really answer that at my level yet. But I did want to address really quickly the training. That's something that, because of Jess and all the work that we have done together for the past year, almost going on 2 years now. When I attend, it's privilege. When I attend these meetings, if I'm coming in, then they know that I have something to say about the way we're handling transgender benefits, the way the phone calls are being taken. Everyone is now looking to me to say, Shada, you actually had this experience with someone. Tell us what you guys experienced. What can we do to make it better? How can we, you know, we're all just people. And that's something that we have to get across to everyone, even if it's someone on the other end of the phone line. We're all people. There's nothing to be uncomfortable about, you know. We should all be able to have open conversation. That is the only way movement is happening, is through open conversation. Jess was very, very open with me in everything. So that way I could take it back and say, listen, this isn't working. Something's wrong. And that's what we're doing. Our ears are open to Ericsson employees. We want to hear what are the issues that you're having, so I can use my privilege, go straight up to senior leadership and say, hey, this doesn't work. We need to do this better. You know, so I'm very, very excited for the things that Jameson was telling me as well. I feel like we've made an awesome connection here, and this is only going to help us move forward.
Liam, I'm conscious of the time. I think there's 7 minutes left. I know we had a poll of questions that we had listed here as well. I think people are just interested to gauge in terms of maybe some of the...
We did. Let me pull that up. So let me refresh it and see where we are right now. So if you have a chance, we've got a few minutes left. So if you have a chance to go in and look at the poll right now, that'd be great. It's on the Pathable website next to the chat. You can click on the polls. So we have a couple of different questions right now. There's 3 questions, which is, where were you at with transgender benefits in your company? We had 21% with full benefits and 71% with some benefits. 8% are here trying to attempt to secure benefits. So on the early session part of that. Now, what are the pain points to providing full benefits? 7% said senior leadership. 15% said company culture, 18% said of lack of business case, 43% said lack of understanding, and need. Can everybody, can people still hear me? Sorry,
yes, we can hear you.
My
hear you, just can't see it.
went off. Thank you. Okay, so so lack of understanding is by far the biggest one, followed by lack of business case. So Gary, do you have, you know, how were you able to prove the business case of needing transgender benefits? And can you give anybody some recommendations in that?
Yeah, so I think I've covered it in different aspects, but I think, you know, I think you have to start where your company is. And I think, again, jumping directly to transgender, and you can imagine, I mean, for us with our headquarters in Texas, that was a difficult conversation to have, but you had to get people there. And I think I'd mentioned earlier this whole process around ADCAR, and I would highly recommend, if you're not familiar with ADCAR, to take a look at it just from a process and methodology perspective, because that really is where I think you just ensure that you're getting the correct audience, you're getting the correct messaging, you're making people aware as to, you know, how the transgender benefits are fitting into the overall company strategy. And that's kind of the biggest, that was kind of, I suppose, the biggest jump for us. I can tell you, you know, in terms of the business case, I mean, there's so much now research coming out in terms of, again, the connection between, you know, those that are, you know, the companies that are excelling at customer experience, you know, they've got 1.5 times more engaged employees. So, and then breaking down what that engagement looks like and why are our people engaged. I can tell you as well, just the impact that I think even our own ERG has had on the culture of the organization, and allowing people to kind of have authentic discussions about, you know, themselves. And even from I don't think we ever thought that the LGBTQ was the first ERG within Ericsson. I don't think we ever thought that it was going to have such an impact on how the culture would change in the organization. So maybe having a link between, again, going from the transgender community to LGBTQ, and the link to culture and the impact that that has on, customer experience. So again, trying to kind of manage those kind of key topics and aligning them to the strategy. And obviously, again, I mentioned this earlier, just the fact that talent for us. Again, I've got my background is more on the business and the technology side. So I'm always trying to see how I can focus my D&I, my LGBTQ and my transgender discussions around that. So for example, when I was giving a talk to, let's say, some of our field staff, some tower climbers around the transgender community, I was thinking in my head, okay, we need to start connecting the dots. I can't come in cold and start talking to these people about transgender when it's probably a completely new topic for us. But as soon as you start mentioning about, maybe our competition, our customers and what they're doing for D&I. So for example, we have we've got some great customers in the US, AT&T, Verizon, T-Mobile. You just need to mention to our frontline engineers that, our customers are offering this. They're offering best-in-class transgender benefits to the community. It just starts to get the conversation going. So I'm happy to take any more conversations around business cases, or if somebody wants to reach out independently, I'm more than happy to take that discussion. Was there one last question, Liam, that we wanted to look at?
I think Shada did answer a question that was in the chat about if covered dependents could access trans benefits without notifying the employee, and Shada replied, yes, 100% that is the case. You do not have to notify the employee that the benefits are being used. You're covered underneath the insurance. Not sure if bills or anything would out the person though. Possibly, if they're living at the same location, that could be a problem. But you can access the benefits without being outed.
Yes, and I'm glad you brought that up, because I wanted to just quickly touch on that, because we have come across that. And even if the employee does call in, certain diagnoses relate back to mental health. And just because they're mental health, there's age limits on what we can and cannot say. So we're very conscious of that. But also, I did have somebody reach out and say, listen, it's just not something I want to do right now. I don't want to cross that bridge with my parents. So I have an alternate address. Can you send my explanation of benefits there? Of course. We can definitely do that. The only thing is, if they ever were to see an explanation of benefits, they're so general, you'll only see lab work, office visits. We will never release a diagnosis. So yes, I did want to just kind of go into that a little bit more, because that is something that would deter somebody from even trying to utilize the benefits. Was, ooh, if I get this third party involved, they may, share information that I'm not ready to share.
The corollary I'd like to add to that is that, I have reviewed some of the statements that I get from my insurance, which lists doctors. And if I see a doctor that I'm unfamiliar with, I will sometimes look them up. And one of the things that happens in this particular scenario is, gender issues are very specialized. So, Dr. Meltzer, for instance, if I saw Dr. Meltzer's office on my bill, I would Google a name and look them up, and voila, I know what the issue is. So there's some things that parents and things can get around that, even though we try and keep it quiet, keep it private.
Definitely. Yeah, so it is, I always just caution, especially young people, right, who are exploring their gender identity, that if they're not ready for their parents to find out, if they're not ready for their loved ones to find out, to be cautious about how they're using, what they're doing, who they're talking to, how they're using their benefits, and make that clear to the benefit coordinator who they're talking to, that this is not something that can be found out by other loved ones in the household, so that they are safe, right? Because that is the primary concern, is that our employees and our loved ones are safe. So We are at the top of the hour, and I am so happy for this discussion today. Thank you all. I know this is the last session on a Friday, so I'm loving that everybody came in with a lot of really great questions and really passionate discussion today. So thank you, Shada, Jess, and Gary for all of your hard work. And we will see you a little bit later today at the closing session.
Thank you, everybody.
Thank you.